I might start more superficial. So I'm looking at trying to find a specific location, like right there. And then I'm sort of assessing, well, what is it? Is it depth? Is it more superficial? Is it deeper? Is there a specific direction? Again, I'm mostly working parallel here. But again, just like we've talked about with anything else, I'm kind of working my way up. And if I find an area, like right in through there, that's a little tighter. Either I continue to work through it or I do my sustained pressure. Okay? I might use my assisting hand, either bringing tissue toward or away, and just kind of hang out there for a little bit. Okay? I have my unlocking spirals. I might try a few different directions, doing perpendicular mobilization as well. Okay, so remember, I'm not strumming here. If this is her paraspinal, I'm coming in next to it, and I'm trying to see if I can do this to it. Okay, that's perpendicular mobilization. Okay, so I come in on the lateral aspect of that paraspinal. I'm just trying to kind of slide it a little bit medially and see how that feels. Okay, we work on sometimes clearing the bony prominences. So we're working on the gutter, what we call the gutter, or sort of between the paraspinals and the spinous processes. Okay, and I kind of work up and through there. And we see kind of how that feels. And again, if I find an area in there that's a little tighter, I just kind of try and work my way through it. Again, sustained pressure, everything you already know. The other bony prominence is obviously around that iliac crest. And I think we talked about this. This was one of the things that we did in the first soft tissue lab, is just working on trying to clear that out a little bit. Okay? The one thing that we're going to add in a little bit is soft tissue mobilization with movement. Okay, so again, the one that I'm going to show you in particular is really good if your patient is lacking a little bit of lumbar flexion. Okay, so to